Dr. Michael Romain with the Austin Diagnostic Clinic joins us to talk about, now April is Stress Month, right?
Stress Awareness Month.
Awareness Month. And talk to me, for caregivers, people taking care of loved ones, family members, nurses.
Correct.
That can be a really stressful job, right?
Correct. It could be very stressful because you have to deal with your everyday stress as well as taking care of a loved one or somebody who is very ill. So it's difficult for people to take care of their everyday stress, and now they have something compounded on them as well, and they have the whole world on their shoulders that they have to deal with.
Now, so what are some of the common signs of stress, and when you know that it's just too much?
Common signs of stress are sometimes manifested in a physical manner. The palpitations or anxiety attacks, headaches. You can have different types of symptoms, stomach aches, things that may make you go to the doctor and they do tons of tests and they find nothing's wrong. Sleep deprivation, all those things can be manifested from stress.
And what are some of the long-term implications of this type of stress?
Long-term implications of stress can be basically illness. You can become chronically ill from URIs, and that's upper respiratory tract infections, or even elevated blood pressure, which can lead to other things such as, heart disease, stroke, kidney disease, etc.
Okay, Dr. Romain, what are some of the answers? Like, what can people do to relieve that stress?
First thing is you have to identify that you're under stress. That's the hardest thing to do sometimes. People always feel it could be something else. You have to take a good, honest look at your life and see if you're going through issues with stress, and then you have to find ways of dealing with it by carving out time for yourself, doing things that you enjoy doing. It could be exercise, it could be going for a walk, or it could just be having quiet time for yourself.
Bottom line is there is help out there for people.
Definitely, there's help out there.
Because a lot of times they feel like there isn't anywhere to go.
Definitely, especially for the caregivers, because they're dealing with the stress of family members maybe asking them questions, and they're dealing with the stress of, oh, I have to go to work, I have to pay bills, I have to do all these things, and they feel like they're alone, and they have to understand that they're not alone. Make sure you identify it, talk to people, talk to your healthcare provider, and they can definitely help you.
Okay, Dr. Romain, thank you very much for joining us today.
Thank you, sir.
Now, for additional information, if you need to get that, you can find that on...
You can find that online. You can. We have an adclinic.com website. You can see your doctor. There's tons of places you can go to.
Just ask for help. Okay, thank you very much.